Well, this is the most common approach that most speech therapists use in speech therapy to deal with articulation. But it's basically where you start with teaching a child their sound. That's, for example, if they have an R error, you would start with the beginning sound in the word. So if it was run, you first start with getting that sound, trying to get that R, get the placement of R, get their tongue and everything in the right place, and then you move to the word in the initial position, then you move to the sound in the final position, and then you usually will move back to the middle position. And then you just increase in hardness as you go, and then you, as you increase in difficulty, you go to like a phrase after words, then you go to a sentence, and then you can go into reading, and then actually into communication. So morphemes are the smallest part of a word that we use, and so on Brown's morphemes, this was a approach that when you do a language sample, you can actually take your language sample that you get from a child and you can compare it against Brown's morphemes, which is an aged, normed program, evidence-based program, where he actually compared children from, I think they go from ages, I think it starts about 6 months until 5 to 6 years old, and you can actually compare if they're on track, if they're at their age level that they need to be, and if they're not, you can actually see exactly which of those morphemes that you need to work on specifically with that child. So it's a really good way to take their language and see where it's breaking down. I work with a lot of ESL kids. We have a lot of kids in one of our schools that do struggle with learning English, and you know, I am seeing a lot of fluency, stuttering issues in these children because they're trying to come up with their words, and so they do a lot of code switching. So they may come up with a sentence and part of it has English, part of it has Spanish in it. It's a struggle for them, and sometimes it looks like that they have a language delay when they really don't. They're just trying to get the English. The teachers struggle with understanding the sounds that they actually have in their language that's cultural. For example, TH is one that you don't have in the Spanish language, but the teachers are always referring their Spanish kids to me because they can't say their TH. And so that's an example of and it's just a struggle for them to get both of those languages coming together. In the long run, it's actually a benefit for them if they can actually get both of these languages, because they're a lot more employable. And so if we can encourage and get them going with these languages. But I do see more children struggling on the ESL level than I do when they aren't learning two languages. But if they have the right support, I think that they can get through it if they don't have a language delay. This is a picture exchange system that you use with children who don't have any language. It's a strong evidence-based program. And it's a program where a child learns how to exchange a picture for language. And so sometimes it brings about their language, and usually it will if they're going to get language. Sometimes it doesn't bring about their language, but it is a very strong evidence-based program that will bring language to children if they can get it. Scripts are something that you teach children to say. So, for example, you have your PECS program that we just talked about. Usually scripts follow a PECS program, sometimes they don't. But scripts are things that you develop. So, for example, if a child can't say, if all they can say is cookie, then a script would be to teach them to say, I want cookie. you teach them those specific scripts that they need to say. Sometimes it bridges them right into their communication. All of these methods have their place. All of these methods, you can try one and it doesn't work, and so maybe you try another one, and it just depends on where the child's at, what their level is, and it's important that you have really good knowledge of everything that's available and everything that's coming available, because there may be things out there that are even better that you haven't tried, and you just need to keep up and learn everything you can so that you can help the children the best. Sometimes you're just kind of throwing things out, like Marcy talked about, guessing here and guessing there, and trying to figure out what, how am I going to help this child. But sometimes you do have to get very, very creative. Sometimes you have to throw a few together and use a couple together, and sometimes you just have to be super creative. I think it's important to use the evidence methods first, and then if those don't work, then you throw in some of your clinician knowledge. I don't think your outcome would be as good if you didn't use the methods. A child-centered approach is where you go in with a child and you kind of just let them lead therapy. For example, if you were to go in to the preschool and they were playing